I think a lot of people will agree that quality improvement is an important activity. And I think people who have worked in an area for a while, they will have easy identify areas of doing things better. But to show that a new way of doing things actually provide better quality and to enable other people to achieve the same better quality, it's important to document both the change that has been implemented and to measure the outcomes of the activity. Quality, it does require additional resources to develop and implement quality improvement. But perhaps because of the quality improvement, it's possible to save resources more efficiently and perhaps make cost savings. Economists talk about opportunity cost of quality improvement. And to invest in QI in one area, that means that the same resources cannot be used to improve quality in other areas. And then it's important to consider where the quality improvement is likely to give better payoff and make the investment where the payoff is believed to be the highest. Therefore, the cost of quality improvement is important and should ideally be balanced out by the future savings and substantial better patient outcomes. And this would require a consideration of the costs that are related to the development and implementation quality and the impact on cost and outcomes. It has become more acceptable to talk about the costs of healthcare. The development and application of health technology assessment is one example where economic considerations are generally accepted to be relevant. And there exist well-developed standards and guidelines for economic analysis and a range of examples where these standards has been applied. It would appear to be less so in the area of quality improvement. During the last year, a small research group from the Royal College of Surgeons had been working with the HSE QI team to describe the current practice of including economic costs and outcomes in Irish QI projects. We have found that there's room for improvement. And therefore, we are excited to be able to report on the current practice of economic analysis in Irish QI projects and discuss how this might be further developed. We are grateful for the collaboration with the HSE QI team and in particular to the participants in today's meeting for taking the time to hear about our findings and engage in conversations about how the Irish QI community might move forward with the inclusion of economic cost and outcomes. I would like to thank my colleagues Siobhan and Samir for their work on this analysis and Jennifer and Maureen for their support and discussions. I would also like to thank the other presenters today for their willingness to take an active part in this meeting. I do hope that this meeting will provide an opportunity to discuss how and in which direction Irish QI should develop a stronger focus on economic cost and outcomes in future QI initiatives. Thank you and welcome.